Welcome to another edition of Inside Medicine. I am your host, Doug Geinzer, and we are here in the studio today with the good doctors from Complete Care OBGYN, a brand new practice right here in Las Vegas, Nevada. And for those of you that are new to Inside Medicine, we broadcast right here in the studio on Thursdays at 10 o'clock. And you can catch us on vegasvideonetwork.com/live, Facebook, YouTube. We push it out through our newsletter, so you will see this video in many, many places. During the show, we bring in movers and shakers in healthcare, those that are doing good things, those that are doing great research, bringing travelers in from out of market to visit wonderful Las Vegas, and those that are opening up brand new practices like the folks here today. Dr. Tanita and Dr. Hsiung, welcome to the studio.
Thank you. Thanks for having us.
It's great to have you. So the practice is pretty new, wet behind the ears, huh? Tell us a little bit about the new practice and when it opened up.
Well, we just opened up in October 9th. We opened our doors, and we are seeing patients as we speak. Dr. Skinner is actually in the office seeing patients.
Somebody has to work today.
That's right. That's right. We have the day off. So.
Sure.
So Dr. Hsiung and I, we're seeing patients. We have openings available right now.
Very good. Where is the practice located? You guys got new space. It's out in Henderson.
Yep.
Whereabouts in Henderson?
It's on Stephanie and Warren Spring. The address is 1520 West Warren Springs Road.
Very good. So very convenient place.
Yes.
Yeah, right by the Galleria Mall.
That's great. What made you select that area? Like, what was appealing about that space?
Well, Dr. Skinner and I worked in the area. Dr. Hsiung was actually in the Henderson or Summerlin area.
Okay.
So Henderson, myself and Dr. Skinner, we live in Henderson. We love that area, the Green Valley Ranch area. I know that that area is just blowing up. There's huge growth in that area, and we got the obstetrics parts were kind of staying close to the hospitals. Henderson Hospital just opened up, and we're going to be delivering there, and then as well as we currently deliver at St. Rose Sienna.
Okay.
And we wanted to be a place that was kind of close, easy access from the freeway, and there's just a lot of traffic in that area, and we're
fantastic. So you drew the short straw. You have to drive from Summerlin?
I did. The place I practiced, I mostly delivered at Summerlin Hospital in my previous job. And Dr. Tanita and I were very close friends, and we did training together at Bayfront Medical Center. And he actually got me this job at Las Vegas on my previous job.
Oh, very good.
And a few months ago, we just decided to open up a new practice together.
Well, congratulations on the new practice. That's a big move, and it's great to hear that you broke away from a larger group. You're starting to deliver a different level of care, and we're going to dive into that a little bit later. Right. In the meantime, I want to learn a little bit more about each one of you personally. So, Dr. Hsiung, we'll start with you. Tell us where you went. Where did you go to med school?
So I was born and raised in Taiwan, and I speak both Mandarin and Taiwanese.
Does that come in handy in Las Vegas?
It comes in pretty handy. There's a good majority. There's a good population of that speaks Mandarin, which is Chinese.
Yeah, you bet.
And so I went to medical school at Louisiana State University.
Go LSU.
And LSU. Yes.
Go Tigers.
And we did residency together at Bayfront Medical Center.
Where's Bayfront? Is that the one up
in St. Petersburg, Florida?
Okay. Yes. Perfect. Beautiful area.
So we were in training together for 4 years, and I moved to South Dakota after residency. I have to repay back some student loans, and I actually enjoyed the experience up in the Midwest. So after a few years ago, Dr. Tanita said, "Come down here for continuous medical education," and we happened to have this opening in my previous job. Yep. So I came down here, and so Dr. Tanita essentially got me down here to join him with a previous job. And a few months ago, he opened up this conversation with me to see if we want to go out and practice together.
How do you like Las Vegas so far?
Oh, I love it. I really. So I was born and raised in Taiwan. The food is very important to me. Of course. And with this Chinatown and the Korean town here, the food is tremendous.
There you go.
Yeah.
Dr. Tanita, tell us a little bit about yourself.
Well, I was raised in San Diego, California,
and
so I've come to Vegas when I was younger, and like Dr. Hsiung was saying, I went to medical school at American University of the Caribbean, which is St. Martin. I did undergrad at Santa Barbara, UCSB, and then we were in residency together at Bayfront Medical Center in St. Pete, and then yeah, like Dr. Hsiung said, I came out to Las Vegas. I had, started practice out here with another group, and then we decided to go out on our own. And I'm married. I have 3 kids, 2 dogs, parakeets.
Very nice.
Yeah.
It's a fulfilling life. So, St. Martin, not much of that island is left after this last round of hurricanes.
Yes, they were actually pretty devastated. We have some friends that live there. Yeah. There was a roof that blew off of our friend's house. It was pretty devastating. We've seen videos. I'm sure a lot of people have seen videos on YouTube. They just built this brand new airport. A lot of people know the airport because, the big 747s come landing.
Takes right off over the...
Takes off,
yeah,
right, exactly.
Yeah.
It lands. People stay on the fence, and then it blows sand in their face. That was pretty intense. But, the hurricane, it was pretty devastating to them.
Yeah,
it was
wow.
unfortunate.
So Dr. Skinner, who's not with us today, somebody's got to be back at the shop, manning the shop.
That's right.
How did you all come to meet Dr. Skinner? What can you tell us a little bit about him?
Well, we worked, actually, both of us worked with him at our previous job. Great guy from Vegas. He's a local.
Okay, right on.
Married. He has 2 kids.
Vegas strong, right?
Yeah, absolutely. Great guy, and one of the most beloved doctors I've seen in Las Vegas. People love him. His patients love him. Very caring, very humble guy, easygoing. Yeah.
So the other 2 doctors, Dr. Skinner and Dr. Tanita, usually work on one side of town. I work on the other side of town, but it's still under the same company. I don't see Dr. Skinner that often, but I have a lot of patients of Dr. Skinner, and that would eventually come to my the Summerlin side of town. And he has very high patient satisfaction review. All the patients I met up with him absolutely love Dr. Skinner.
And that's important nowadays.
Oh,
patient satisfaction is like one of the biggest scoring mechanisms.
Exactly.
So let's dive in a little bit, just for the laymen that are out there, the difference between OB, GYN, and how the practice has different components and how those integrate together.
Sure.
Okay. Take us, again, those of us that live and breathe healthcare every single day get it. Those that may service the industry may have a little bit of an understanding, but can you help us better understand that?
Sure. So obstetrics is mostly deal with issue with a pregnant patient, and gynecology is an area of medicine that deal with female issues in general. So in our practice, we deal both obstetrics and gynecology.
Okay.
So in the obstetrical field, we see patients who are pregnant and in essentially all branch of sorry.
Oh, it's okay.
Yeah, Dr. Sunil, would you?
Yeah, I mean, the obstetrics part is delivering babies essentially, and the gynecological part, there's a whole list of issues with gynecology. I mean, you have anywhere from dealing with birth control, abnormal uterine bleeding, cramping, later on menopause, and all kinds of topics.
And all 3 of you are board certified.
Yes.
That's correct. That's correct.
That's good. And so your practice, it's new.
Yes.
What are you going to do to set yourselves apart from the others? We've got a couple groups in town that have rolled up a lot of the doctors into these large, massive practices. You're now a team of 3. Right. How do you scale up your level of care? What is it that you're going to do to really set yourselves apart from the other competition out there?
Yeah, I think really our motto, our mission statement is to provide excellent healthcare to women. And I think, I think everybody, I'm a patient, we're all patients, and we've seen doctors. And I think that, some of the problems that we all face and going to the doctors are common to all of us, whether it's an OBGYN or pediatrics or family practice for that matter, long waiting times, not able to get in to see your doctor. It's not uncommon to hear people trying to make an appointment. They can't get in for 4 or 5 months. I mean, it's insane. Really what we're trying to provide is an incredible experience. So women come in, they're seen right away. We have openings today that are available. People can make an appointment and get in today and to be seen. We don't want to be so busy as to have no appointments available for months at a time. We've kind of looked at each other and said that this is just not providing good health care. Why are we seeing new patients if we can't take care of the patients that we have?
And that shows in your patient satisfaction scores too, because
Absolutely.
the patients want that one-on-one experience.
And it's good healthcare. So if someone's having, if a woman, so like Dr. Hsiung is an excellent surgeon, minimally invasive surgeon. If a woman has bleeding issues, fibroids, and she needs to get worked up, she's got an issue, doesn't know what's going on, comes in, has bleeding issues, and goes, what's the problem and how do I fix it? We'll make an appointment with Dr. Hsiung. He'll order labs, maybe do an ultrasound. Does she have fibroids? Does she have any issues? Rule out different things. If, let's just say, for example, she has fibroids and she's done having babies and decides, okay, you know what? Maybe a surgical approach is the way, there's a lot of non-surgical approaches that we go over everything. But if surgery's what she wants and it's the path going forward, certainly you need time to come in, do an initial workup, to do testing, go over those results, set up surgery, and eventually do the surgery and post-op care. Yep. So all that takes time, and it takes multiple visits. If you're spacing that out 3 or 4 months out, you can't get an appointment for 4 months. Yeah. That's a problem. I mean, that can expand a whole year, and in the meantime, could be bleeding, having issues and problems.
Yeah, one of the things when I take care of a patient is that my scope of practice has changed quite a bit since I was a medical student and resident. Now that I'm finished residency and doing practice on my own, I really want the patient to receive the best care. And at the end of my conversation, I will always tell patients, my recommendation for you is the same recommendation I will make for my family, for my sister, for my mom. And I think that's very important. One of my strengths is explanation. I like to teach, and I like to make sure the patient gets proper explanation. One of the worst things I don't want to see, and this happened to a lot of the patient, is that they come in here and they're on a spectrum of medication. Yeah. And I ask them, so what is the reason you're taking this? Why is doctor prescribing that? They don't know. All they say is, I'm on this but my doctor says I need it. So at the end of my appointment, I want to make sure the patient is properly educated and understands exactly what's going on. I'm a pretty big on number person. So I like to go down the road. Number one, you're here because of this reason. Number two, this is what we're going to do for you. Okay. And of what we're going to do, subcategory A, we're doing this. We're going to prescribe medication. Subcategory B, we're going to go into some imaging study. Subcategory C, we're going to see you in 2 weeks to see how you respond to all this treatments that we're going.
Patient communications is absolutely critical.
You can tell Dr. Hsiung is very thorough.
Absolutely.
He crosses every T and dots every I.
Yep. So are you the only surgeon in the group?
No, we are all
we all
gynecological surgeons. Okay. And I did training with Dr. Tanita. We had a great experience in training together. And he is also a very strong gynecological and obstetrical surgeon as well.
Very nice. And y'all deliver babies?
Yes.
Yep.
Which hospitals? Absolutely. Sounds like you do quite a bit out in Henderson, and you do some in Summerlin area. Which hospitals do you deliver?
So we're going to be we're just credentialed at Henderson Hospitals, the new hospital over in Henderson, obviously, and then we are also going to be delivering at St. Rose Siena.
Okay, very good.
Which is off of St. Rose and Eastern.
Yeah, very good. Both great hospitals. Yeah,
yep.
No, it's
absolutely.
It's been fun watching the Henderson Hospital enter the marketplace out there. Boy, has that changed Henderson.
And they have great staff. The nurses there are amazing. They're awesome. I don't think they get enough credit, so that's a shout out to all the nurses out there. So.
Yep. So tell me, the typical patient that comes in to see you, what are they looking for? What is it that what type of treatments are they asking for?
One of the most common one that a female needs on a yearly basis is an annual well-woman examination, and Pap Smear is a major important part of that annual exam. So why do we do a Pap Smear? That's one of the most important questions to ask. Pap Smear is utilized to screen for cervical cancer. Before the onset of cervical cancer, before the onset of Pap Smear, that is one of the major leading cancer, as well as a form of death for the on patient disease list. So when a patient comes in to me for Pap smear, I make sure I fully understand why we're doing it. Cervical cancer is one of those diseases that does not grow overnight. It takes a long time to develop. And so when we do a Pap smear, we screen for cervical cancer. Pap smear result comes back in different form of stages. On one hand, you have normal Pap smear. On the other hand of spectrum, you have cancer. And the goal of a Pap smear is to make sure that we catch it before it progresses to the advanced phase. And there's certain, once we perform Pap smear and it comes back in different stages, we'll inform the patient what we need to do. Do we need to bring her back for a re-examination? Do we need to bring her back for another repeat Pap smear? Or do we need to use any kind of surgical intervention in treatment of this abnormal Pap smear?
So the technology on that is really changing in how we detect abnormal Pap smears. It used to be just we would grab cells from the cervix, put it under slide, take a look at it under cytology, and basically evaluate if there are abnormal cells. But nowadays, with technology and DNA study, we're able to look at different pathogens that can cause abnormal Pap smears, the HPV virus specifically. And so now, with the invention of new technologies and detecting tests that detect, we, in the past, a woman would just say, hey, I need my annual and Pap smear every year. And it was kind of synonymous. I'd get a Pap smear once a year. But because we're so good with the understanding of the Pap smear or the pathology of abnormal cells, they've now spaced out Pap smears where you only need them every 3 to 5 years. Now, that may be a little scary to some people and going, well, am I not being covered? Am I not being screened properly? But really, in order to have an abnormal Pap smear and eventually, God forbid, cervical cancer, a requirement is that human papillomavirus. First, you get that human papillomavirus, and then it can progress to cancer. If you don't have the human papillomavirus, very unlikely it's going to progress to anything serious. And so if you screen for the human papillomavirus, then you can space it out. And we're looking at that specifically. So, the guidelines have changed. ACOG, which stands for the American Congress of Obstetricians and Gynecologists, have done tons of research over many, many years. They're constantly renewing guidelines. And that's one of the areas where the guidelines are changing. So a lot of women will come in, hey, I thought I'm supposed to have a Pap smear every year. And, to help explain to them, hey, it's not necessarily every year because the technology is so good.
Yeah, what I usually explain to patient is that when patient comes in, and I will make my recommendation based on ACOG. The recommendation is that patients less than 30 years old gets a screening Pap smear every 3 years, and beyond age of 30, it's every 5 years. Now, that makes a little difference whether you're HPV positive or negative. Depending on those screening criteria, I will communicate this to patient. I will also tell patient that I understand that even though the recommendation says this, if patient's not comfortable with recommendation, I do not have an issue in performing a Pap smear on a yearly basis or a biannual basis.
And they're fully covered by insurance, yeah.
That is correct.
Okay,
that is correct.
That's what I thought, yeah.
So I also make the point that as long as your insurance covers for it, and to my experience, majority of insurance will cover this.
So this is one of those, it's a simple test that will help save dollars in the future. As we all know, healthcare expenses have been on a little bit of a runaway, and this will help control that because it helps catch the any issues before they become more severe.
Sure. I mean, you can get bogged down in a lot of the details and the technology of it, but, in essence, you're really, you're trying to prevent cervical cancer, and it's a screening test for that.
Yep. Do you have mid-level practitioners in the practice? Is it just the 3 docs?
It's just the 3 docs right now. We don't have any nurse practitioners or PAs. Maybe eventually.
Yeah. Take a look at your practice. What does it look like in a couple years? What are your hopes and dreams, and where do you plan on going with this? And if you don't care to share, then say that.
Yeah. I think there's a huge need, especially in the Henderson area. I mean, it's pretty amazing on how difficult it is to get in to see an OBGYN, to make an appointment. It's almost unheard of to go, I need an appointment. Can I get in this week? Much less, within days. So I think that there certainly is a huge need for OBGYN specifically in Las Vegas, but just doctors in general.
So talk to me, I heard both of you mention ACOG. right?
Yes.
And I believe y'all are fellowshipped over there, or?
Yep. So ACOG is a society among obstetricians and gynecologists. You have ABOG, which is kind of the board.
Okay.
A lot of the members that are on the board of ACOG are on the board of the American Board of Obstetricians and Gynecologists. The board kind of certifies you, but ACOG is kind of an ongoing society that helps put out guidelines and does lots of research.
Yes. And that's what helps you with your continued education.
Absolutely.
Yes.
Yep.
Very good.
On a yearly basis, all the obstetricians and gynecologists needs to recertify on our board certification status, and ABOG will give us a certain literature to review, and we take a test and make sure that we are up to date on our current certification.
That's great. Excited to hear about the new practice. Congratulations.
Thank you.
It's a big thing. We've covered a lot of ground today. Is there anything that we did not cover that you want the audience to know?
Well, we have a brand new building. It's beautiful inside. My wife designed it, actually. She did a phenomenal job. Excuse me. Great interiors. I mean, we have big exam rooms, and we're just waiting to bring the patients in. I think that what they'll find is when they come in, it's just the interiors are beautiful. But what was really important for us is to have staff that was very friendly, excited, wanted to make a difference. And that was really important to us, because I know that, if you come in and the front desk doesn't, respect you or give you time, and they're on the phone and they don't want to listen to your problems, that's not providing excellent health care. So we paid very close attention to the people that we hired. We have a phenomenal staff. They're awesome. And I think when people come in, they're going to be blown away by just the office, but really the people there.
Yep.
And I went into practice with Dr. Tanita and Dr. Skinner. And these two I speak highly of. These two guys are men of integrity and honesty. And I also believe that we all have the similar idea and concept in wanting to provide great care of OBGYN to all females. And both Dr. Tanita and Dr. Skinner have the similar concept in treating patients with respect and give the same recommendation to our patients as we would to our own family member.
Fantastic. Again, congrats on the opening of Complete Care OBGYN. Folks want to get in touch with you. What's the best way for our audience to reach out to you? What's the best means?
They can go to CompleteCareOBGYN.com.
Fantastic.
That's probably the best way.
It's a great way. Doctors, again, thank you for coming into the studio. To our listeners and viewers out there, thank you for joining us for another episode of Inside Medicine. We look forward to seeing you in future episodes. Please check us out on YouTube, Facebook Live, Vegas Video Network, and all of our channels. And until the next one, you have a great day. Thanks again.